Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Glasgow, Blatchford, scoring, and this is in case of the UGI bleed. So the first one is the admission risk markers, and we are looking at the scores respectively. So what is the blood urea? So in case of blood urea is 6.5 to 8. So 6.5 to 8, the scoring will be 2, and then from 8 to 10, it is going to be 3, and then from 10 to 25, this will be 4, and from greater than 25, so greater than 25 will be nothing but 6. Now let's look at the hemoglobin. So hemoglobin, there is in case of men and women, and men it is 120 to 130. So 120 to 130, what is present? It is including 1, and 100 to 120, it will be 120 to 131, and 100 to 120 to 120, it will include 3. So it is, if it is less than 100, it includes 6. Then comes the woman. Woman is 100 to 120, because this includes 1, and then less than 100. So less than 100 is 6. Now what about the systolic? The systolic BP. Systolic BP in Fmge, it is from 100 to 109. So this includes a score of 1, and then when it reduces by 10, that is about 90 to 99, it is about 2 score, and less than 90, it is about 3 score. So systolic, as it decreases, it will increase the score, and hemoglobin, as it decreases, again it increases the score. So now what about the pulse? The pulse is, if it is less than 100, it is again a score of 1. Now looking at the history and comorbidities, the melena. So in case of melena, it is 1. In case of the syncope, it is 2. And in case of hepatic disease, it is 2. As well as in case of cardiac failure, it is again 2. So the total score ranges from 0 to 23. And the score of 0, it can be considered for the early discharge. And score of 6. The score of 6 or more, it's associated with greater than 50% of the risk for the intervention. To learn and grow daily like this, please do subscribe.